Hello everyone, my name is Joshua Grenier. Today I'll be giving you a informative speech. Let's begin. I want to start off by speaking about something I'm sure most of us have heard, and maybe even some of us do ourselves, and that is snoring. Now, snoring is typically loud, aggravating to hear, and in some scenarios it can be disruptive, very disruptive. But what most people don't know is what actually causes snoring. Um, if you're like myself, you snore. Usually it's caused by like traumatic brain injuries, but it can develop naturally as well. Um, I've been dealing with snoring for quite some time myself, and I know it's indicative of a much larger issue. The purpose of this speech is to inform you about sleep apnea, the dangers that are associated with it, the procedures and treatments that are available to those that have sleep apnea as well, and also just go in depth about what exactly those procedures are. In this speech that I've prepared for you, you will learn what sleep apnea actually is, what the three types of apnea variants are, and we'll cover how the body reacts when sleep apnea occurs during deep sleep. Next, let's talk about obstructive sleep apnea. Obstructive sleep apnea is the most common type of sleep apnea that occurs, and according to the Mayo Clinic, it occurs when the throat muscles relax to the extent that it dramatically decreases the amount of oxygen you're intaking. When obstructive sleep apnea occurs, it causes you to gasp, choke, snort, and occasionally just stop breathing altogether. Typically, that'll wake you up though when that happens. It's typically brought on by the relaxing of the throat muscles, but that can happen upwards of 30 or more times a night. So it's really dependent on how severe the case of sleep apnea is in the individual at that point. This means that even though you think you know you slept a full night, you may not have gotten the full benefit of deep sleep due to constantly waking up throughout that night. The consequences of not getting a full night's rest could be feeling really lethargic throughout the day, having a much more heightened sense of irritability. You would also probably get periodic headaches. You would have difficulty focusing, completing tasks, things like that. And then also you would have a lowered immune system as well. You'd be more susceptible to getting sick, things of that nature. And that's all those facts can be brought on by obstructive sleep apnea, but they also can increase because of sleep apnea as well. So not directly caused by sleep apnea, but can be increased. The next form of sleep apnea we'll talk about is central sleep apnea. Central sleep apnea is different than obstructive sleep apnea in the sense that it's not the cause. The cause isn't just your muscles. In this case, the cause is your brain. So your brain's the one not doing its job. With central sleep apnea, your brain fails, or somehow something's caused it to stop sending the signals to your muscles. the muscles that regulate your natural breathing cycle. So um, basically, you forget to breathe like altogether, and we all know that that's not good. um, this makes it arguably far more dangerous than obstructive sleep apnea in the sense that, um, well, the risk of passing away when you sleep is greatly increased. So you're not just not getting the benefits and you're feeling tired the next day. You're dead. Uh, so very much more dangerous. The the use of opioids, heavy medication, um, also greatly increases the dangers of this. Another known factor was individuals who are veterans. They have about a 40% higher chance of uh, passing away during sleep than an average civilian does, just due to stressors they've experienced in their life and things of that nature, and so on and so forth. After central sleep apnea, there's what they call complex sleep apnea syndrome, and it is without a doubt the most dangerous of the three forms of sleep apnea because complex sleep apnea consists of obstructive sleep apnea and also central sleep apnea. So you don't just get its own separate set of symptoms that it gives you. You get the culmination of obstructive sleep apnea's symptoms and central sleep apnea symptoms combined. So very dangerous, to put it lightly. uh, Central sleep apnea is more common in individuals though that are male, middle age, and typically tend to be older. And like I said earlier, they have if the individual has a heavy history of using opioids or specific medications of that nature, then that also greatly increases the risk associated with sleep apnea disorders. Um, so that's also good information to keep in mind. All right, so we'll begin to talk about treatments and procedures now. Um, there are many different treatments for sleep apnea, but it would seem that the most effective one so far is using a CPAP machine. Now, CPAP stands for continuous positive airway pressure machine. This machine pumps air into your air passageway at a specific pressure. So usually this is adjusted to whatever you require depending on how severe your case is. And typically your doctor is the one that decides or helps decide what the pressure setting will be. But the downside of having one of these machines is that in order for it to be like really useful, you have to sleep with a mask all night, no ifs, ands, or buts. In order to get the full effect of it, that's what's required. And that being the case, even though it's the most effective, a lot of people have like issues with it because it makes them uncomfortable, and they end up waking up multiple times throughout the night, and or just not even be able to go to sleep with it at all anyways. And so that also therein, it's kind of not eliminating any problems. It's in that sense, it's just like reproducing them. So There's other forms, but still CPAP is still proven to be the most effective one so far. Um, the other pressure device would be called a ASV, and ASV stands for um, adaptive servo ventilator. Adaptive servo ventilator. This airflow device is different than a CPAP in the sense that it tunes itself to your natural rhythm of breathing. So instead of having a doctor like set a specific pressure for you, and maybe you have to remain on that pressure constantly, the adaptive servo ventilator monitors you and your natural way of breathing, and then when you go to sleep and you stop breathing, instead of just kicking in with that high pressure, it'll continue your breathing with the same kind of pressure you had naturally. So it's as if there's no change, which is very impressive, but they're not widely available yet. They're still rolling them out, but hopefully here soon. Um, the the other forms of treatment would be surgeries. These are typically only considered in like severe cases, though, or after like non-surgical treatments have failed. So after the CPAPs failed, after the ASVs failed, then the doctors would probably resort to surgeries to try and fix the issue. Um, but it severely impacts your quality of life, especially if you're younger, and so they try to avoid that pretty early. They try to avoid it, until very later on in the process. Some examples of surgeries would include the tissue shrinkage or removal, which involves they kind of go in with like a laser or like a microwave, a radio frequency microwave emitter, and they go in and they burn off tissue to make the surrounding tissue around your muscles smaller, and in order to allow more airflow in your airway. Typically, CPAP has proven to be more effective though than those, so it almost never happens unless it's severely needed. Um, yeah, there's not much more to say about that. There's also repositioning your jaw, um, and using like implants. These allow for more space between like your tongue and your palate, which also is to increase your airway, like the amount of air you're able to intake. Um, but again, CPAP performs those same functions without the need of chopping or burning things off. Um, so, um, the last possible form of treatment is a tracheostomy. And if you don't know what a tracheostomy is, it's a procedure in which an opening is made in your neck, allowing for a tube to be stuck in, and air is intaken through that tube and into your lungs, bypassing the muscle functions of your upper throat. That's typically the most severe treatment, though, that's available. Kind of like a last resort. Like, you need this to breathe. So that doesn't happen very, very often at all. But those are essentially all the treatments that are available. It doesn't There hasn't been much more done for sleep apnea because the treatments that are available now are relatively effective. Um, so there hasn't been much movement um, in this field. But there's that. So it seems that we are now reaching the end of the speech, and with that, I'd like to summarize the main points that I've covered previously, and just kind of go over them and talk about them and explain them a little bit more. Um, so obstructive sleep apnea, to summarize, causes you to relax your throat muscles in your throat, which leads to gasping, choking, snorting, or our favorite, snoring. It can happen many times throughout the night, depending on how severe your case of sleep apnea is. We also covered central sleep apnea and complex sleep apnea, which obviously is the worst of the three because it combines both central and obstructive. When we talked about central sleep apnea, we talked about how it wasn't the muscles of the throat, but it was actually the brain itself that was the cause of the issue, or the cause to stop breathing. And then lastly, we talked about treatments and procedures, and I think based off of the information that I provided there, we can surmise that CPAPs are probably the most effective treatment thus far, aside from adaptive servo ventilation. But I think there's still more data that needs to be gathered on that. But CPAP is definitely proven to be the most effective solution aside from surgeries, but we also found that they tend to avoid those as much as possible. So CPAP is the most effective treatment. There you go. There you have it. It is my hope that you took this valuable information that I collected, and that you can hopefully one day use it to benefit from later. Maybe it'll come up in conversation, maybe you'll use it for something more, but it's my hope that you took something from this, and at the very least, now you know if you have a family member and they're sleeping and snoring extremely loud, when you wake them up, you can say, hey, your obstructive sleep apnea is very loud today. Thank you.